At Asawana Farms, we believe food as medicine must be more than a program. It must become a sustainable way of life. Fresh vegetables can improve health, but true impact happens when people are not only given healthy food, they are also taught how to grow it for themselves. That is the idea behind our partnership with the University of Maryland Capital Region Hospital. Last summer, Asawana Farms partnered with the hospital to provide fresh organic vegetables for patients, while also teaching a simple but powerful lesson. Even without land, even without a large garden, people can still grow nutritious food at home. We prepared grow bags filled with soil and compost and planted crops such as moringa, bitter leaf, kale, and Swiss chard. These grow bags were placed at the hospital, cared for, watered, and nurtured, and they produced a beautiful harvest. The message was clear. Lack of space should not be an excuse. With the right guidance, patients and families can grow food in small spaces and take greater control of their health. Food as medicine should not end when funding ends. If we truly want healthier communities, we must teach people how to grow something for themselves, something nourishing, something healing, something culturally meaningful. At Asawana Farms, our mission is to help make that vision real. Our pilot project with the University of Maryland Capital Region Hospital showed that growing food can become part of healthcare. Two of the crops we highlighted were moringa and bitter leaf, plants long valued in many communities for both their nutritional and traditional wellness benefits. Moringa is known as a nutrient-dense plant, rich in vitamins, minerals, and antioxidants. It can be used to support healthy diets and overall wellness. Bitter leaf has long been valued in African and other traditional food cultures and is commonly used in soups, stews, teas, and wellness practices. One of the most powerful lessons from this project is how easy these crops can be to grow. You do not need a large farm. You do not need acres of land. You do not even need a backyard. With a simple grow bag, good soil, compost, water, sunlight, and the right guidance, patients and families can grow food in small spaces, near a porch, behind a building, in a yard, or anywhere sunlight is available. That is exactly what happened at the University of Maryland Capital Region Hospital. Using grow bags prepared by Asawana Farms, the hospital cared for the plants behind one of its buildings. With simple watering and attention, those plants thrived and produced a bounty harvest. That experience proved that this model works. When patients follow the step-by-step instructions provided by Asawana Farms, growing moringa and bitter leaf becomes practical, manageable, and empowering. We teach people how to prepare the grow bags, how much water to use, where to place the plants, how to care for them, and when to harvest. Harvesting these crops is simple and rewarding. Moringa leaves can be clipped regularly as the plant grows, allowing for repeated harvests over time. Bitter leaf can also be harvested leaf by leaf or stem by stem, making it a practical crop for ongoing household use. These crops can be used in many simple and practical ways. Moringa leaves can be added to soups, smoothies, teas, sauces, or dried and used as powder. Bitter leaf can be washed and used in soups and stews, blended for traditional preparations, or dried for tea and other uses. To make food as medicine a reality, we must build systems that last. That means teaching people not only to receive healthy food, but to grow it. It means creating a model where health, dignity, knowledge, and sustainability go hand in hand. Our experience with the University of Maryland Capital Region Hospital last year showed that this vision is possible. With support, Asawana Farms can help scale this work, reaching more patients, more families, and more communities with practical tools to grow their own health.
Shining like a healing dream. Food as medicine. Pharmacy so true.